In this session, we will discuss about radial nerve complete course from beginning to end. For that, I am taking the anterior aspect of the arm and forearm, posterior aspect of the arm and forearm. For that, I am taking the scapula here. So, you know this is the scapula, this is the superior border, and here suprascapular notch. This is the coracoid process. This is the inferior angle, and here is the cavity, glenoid cavity. This is the head of the humerus, here is the shaft of the humerus. Then in the lower part, this is the medial supracondylar ridge, and here is the lateral supracondylar ridge. This is the medial epicondyle, and here is the lateral epicondyle. Here you can see the trochlea, and here you can find the capitulum. Here is the radius. This is the head of the radius. Here is the neck of the radius, and here radial tuberosity, and here lower end of radius. This is the styloid process of radius. Here is ulna. Here radial notch of ulna. This is the head of the ulna. Here styloid process of ulna. So this is the anterior aspect of arm bone and forearm bones. And if you observe here, here scaphoid, here lunate, here triquetral, and here pisiform bone. This is the trapezium, trapezoid, capitate, hamate. Hamate contains hook of hamate. Then here, this is the first metacarpal bone. Here is proximal phalanx of thumb. Here is distal phalanx of thumb. Here second metacarpal bone, proximal phalanx of index finger, middle phalanx of index finger, terminal phalanx of index finger. Same manner, third one. These are the bones of upper limb from anterior aspect. Same diagram we will draw posterior aspect. Here, this is the medial border of scapula, suprascapular notch, and this is coracoid process, and here glenoid cavity. And since it is posterior aspect, we have to draw one structure. What is that? Spine of scapula. This is spine of scapula, and here is the acromion process. So this is the head of the humerus now. This is medial epicondyle, lateral epicondyle. Since it is posterior aspect, we have to draw one fossa here. What is this fossa? Olecranon fossa. In the olecranon fossa, there will be accommodation of one process. What is that process? Olecranon process. Then, this is the posterior border. Here is radius. This is the radius from the posterior view. Then, we will draw the carpal bones and metacarpal bones also. Scaphoid from the posterior view, and here lunate from the posterior view, and here triquetral. In the same manner, you can see trapezoid here, here trapezium, capitate, hamate, and here first metacarpal bone, proximal phalanx, and distal phalanx. Second metacarpal bone. Here third. This is the skeleton of upper limb, anterior view and the posterior view. What is the muscle which is attaching to this fossa? What is this fossa here? This fossa, what we call subscapular fossa. And this is the humerus, no? Humerus from the anterior view. So that you can see one tuberosity here. What is this tuberosity? Lesser tubercle or lesser tuberosity. And here greater tuberosity. Here sulcus is there. What is sulcus? Intertubercular sulcus. Now, we will see the muscle which is taking origin from the subscapular fossa. I am drawing the muscle. This is the subscapularis muscle. It is taking origin from the subscapular fossa, and from here the tendon is going laterally, and it will be inserting to which tuberosity is this? Lesser tuberosity. So what is this muscle? This is the subscapularis muscle. Then here one tuberosity will be there below the glenoid cavity. What is the tubercle called? Infraglenoid tubercle. So this is the infraglenoid tubercle. Infraglenoid tubercle is giving origin to long head of triceps. This is the long head of triceps. Then this is the lateral border of scapula. Lateral border of scapula is giving origin to two muscles. What are those? Upper muscle is teres minor, lower muscle is teres major. So here teres minor. This is the teres minor muscle. This teres minor muscle inserting to the lower impression of greater tuberosity. Actually, in the greater tuberosity there will be three impressions: upper impression, middle impression, and lower impression. Upper impression is giving insertion to the supraspinatus, middle impression to the infraspinatus, and the lower impression to the teres minor. That I cannot show you because it is present in the posterior aspect, and I am drawing this diagram as anterior view. That's what I am showing only up to here. It is going back. Next muscle, teres major muscle. This teres major muscle is inserting to where? It is inserting to the, what is this sulcus here? Intertubercular sulcus or bicipital groove. Intertubercular sulcus having the two lips, medial lip and lateral lip. This medial lip is giving insertion to the teres major muscle. This is the teres major muscle. Actually, these intermuscular spaces you can only see from the behind, but for our convenience, I am drawing these spaces from the anterior view also. Same diagram if you draw there, here is supraspinatus muscle. This supraspinatus muscle is passing deep to the coracoacromial arch, and it will be inserting to greater tuberosity upper impression here. And this is the infraspinous fossa. This infraspinous fossa is giving origin to the infraspinatus muscle, and it will be inserting to middle impression. Next, what is this tuberosity? Infraglenoid tuberosity. So, from the infraglenoid tuberosity, this is the muscle. What is this muscle? Long head of triceps. This is the long head of triceps. And from the lateral border of scapula, here teres minor muscle. This teres minor muscle inserting to the lower impression of greater tuberosity. Then here is the teres major muscle. This teres major muscle is taking origin from the lower 1/3 of the lateral border of scapula, and it will be inserting to medial lip of intertubercular sulcus. We have drawn long head of triceps, and where is lateral head and medial head? See here. This is the spiral groove here. Here there is spiral groove. Spiral groove having lateral lip and also medial lip. So in between these two there is a groove. This groove what we call spiral groove or radial groove. So to this lateral lip there is origin of, here I am drawing the cut section of lateral head of triceps. This is the cut section of lateral head of triceps. Then what is remaining this total one? Medial head. That means lateral lip is giving origin to the lateral head of triceps, medial head is giving origin to the medial head of triceps, and medial head of triceps not only taking origin from the medial lip, it is taking origin from the area below the medial lip of spiral groove also. That means the total posterior surface below the spiral groove. Right? Along with that, this triceps muscle is taking origin from the lateral and medial intermuscular septum also. Let me draw the medial and lateral intermuscular septum. Here lateral intermuscular septum, here medial intermuscular septum. So this muscle is taking origin from the medial and lateral intermuscular septum also. And where it will be inserting? It will be inserting to the superior aspect of the olecranon process. So here this is the insertion. Now what is this? This is the lateral intermuscular septum, and here is medial intermuscular septum. This is the triceps. Now we can see quadrangular space here, upper triangular space and the lower triangular space. And here also from the anterior view you can see the quadrangular space here, upper triangular space here and the lower triangular space here. Now we will draw axillary artery and brachial artery here. Actually axillary artery is present in front of the structures which are forming the posterior wall of axilla. What are those? Subscapularis muscle, teres major and latissimus dorsi. Right? Over that, if you draw artery, this is the axillary artery. Axillary artery continues down as brachial artery. So you can draw axillary artery like this, and it will be continuous down as brachial artery. I am drawing improportionally larger because we wanted to show some structures here. So that's what I am drawing little larger. So what is this artery? This is the axillary artery. Axillary artery continues down as brachial artery. I am cutting this here. Now behind the axillary artery there will be one cord. What is that cord? Posterior cord. See here, behind this there will be posterior cord. I am drawing dotted lines. That means it is present behind. Actually, this posterior cord will give so many branches. At this level, if you observe one branch which is entering into this space, what is this nerve? One branch which is entering into this space. What is this space? Quadrangular space. So, what is this nerve? This is axillary nerve. Then, just below the axillary nerve, the continuation of posterior cord is radial nerve. This radial nerve is entering into which space? Lower triangular space. See here, it has been entered into lower triangular space. That means, if you take the radial nerve is branched from the posterior cord. Let me draw very clearly. This is the branch from the posterior cord. Radial nerve is branched from the posterior cord of brachial plexus. Root value is C5, C6, C7, C8 and T1. This is the root value of radial nerve. Okay, and it is branched from the posterior cord of brachial plexus. In the axilla, it is present behind the third part of axillary artery and behind the proximal part of brachial artery. Is that clear? So, I am telling anterior relations. Anterior to this nerve, in the axilla, third part of axillary artery and proximal part of brachial artery. Then if you see posterior relations, see, it is resting over subscapularis muscle, teres major muscle and latissimus muscle dorsi. That means posterior relations are whatever the structures which are forming the posterior wall of axilla, those are the posterior relations. Is that clear? In the axilla, these are the relations. This nerve don't want to stay for more time in the axilla. This nerve wanted to leave the axilla. So, it will find one route, that is the lower triangular space. Through this lower triangular space, nerve passes behind. That means it enters into posterior aspect of the arm. So, through the lower triangular space along with profunda brachivessels. See here, this is the brachial artery, no? This brachial artery will give profunda brachii, right? So, along with profunda brachii, this radial nerve will be entering into the groove. What is this groove called? Spiral groove. So, now I am drawing dotted lines because we are seeing from the anterior view. This is the profunda brachii artery, this is the radial nerve. Same diagram if I draw here. That means as soon as it enters into the lower triangular space, we can see here because we have drawn posterior aspect here. So, this is the radial nerve. All of you must be aware of it. What are the boundaries of lower triangular space? Superiorly by teres major, medially by long head of triceps, laterally by medial border of humerus. This nerve passing through the spiral groove in between the lateral head of triceps and the medial head of triceps. In the spiral groove, it is having the naked contact with the bone. That means it is intimately contacted with the spiral groove. Actually, it is a dangerous area because this nerve is intimately contacted with the humerus. That means bone is hard substance, and if it is compressing against any hard substance, which leads to severe compression of radial nerve. Usually it will happen in the Saturday night palsy. Clear? So, this is the radial nerve. Of course, we have drawn the one artery here. What is this artery? Profunda brachii artery. So, here is profunda brachii artery. We are least concerning about profunda brachii artery at this session. Here, this is the septum. Which septum is this? Lateral intermuscular septum. Right? So, here, lateral intermuscular septum is there. Now, radial nerve is piercing this septum. Why? It has to enter into the anterior compartment of arm. That's what it will pierces here. So, it will pierces the, which septum is this? Lateral intermuscular septum and appears in the anterior compartment. It pierces the lateral intermuscular septum and appears in the anterior aspect of the arm. This nerve, after passing through the spiral groove, it reaches to the lateral end of the spiral groove and it pierces the lateral intermuscular septum. So, here it is piercing the lateral intermuscular septum. It is piercing the lateral intermuscular septum and coming to the anterior aspect of the arm. Now, it is appearing in the anterior aspect of the arm. Of course, here profunda brachii artery will be there along with it, but we are not discussing about it. Now it is present in the anterior compartment of arm. Here it is present in between the brachialis medially, brachioradialis and extensor carpi radialis longus laterally. That means here, this is the brachialis muscle. I am removing the brachial artery little. So here brachialis muscle origin. This is the brachialis muscle. Of course, it will be inserting here. So what is this muscle? This is the brachialis muscle. Brachialis will be inserting to the ulnar tuberosity. Of course, here there will be one more tendon. What is this tendon? Tendon of biceps. I am cutting here. This is the tendon of biceps. Now, in the lateral aspect, there will be two muscles. This is the lateral supracondylar ridge. No? This lateral supracondylar ridge is giving origin to two muscles. See, if you take the upper 2/3 brachioradialis, lower 1/3 extensor carpi radialis longus. So those muscles will draw here. This is the upper 2/3. This part is giving origin to the brachioradialis muscle. So this is the brachioradialis. This brachioradialis muscle inserting to where? It is inserting to the lateral surface of the lower end of the radius just above the styloid process. So what is this? This is the brachioradialis muscle. One more muscle is taking origin from the lateral supracondylar ridge. What is that muscle? Extensor carpi radialis longus. For color differentiation, I will draw with a different color. So here, this is the muscle, extensor carpi radialis longus. Right? This extensor carpi radialis longus muscle is taking origin from the lateral supracondylar ridge, and where it will be inserting? It is inserting to the base of second metacarpal bone. Why I have drawn these structures? See, brachialis muscle medially, brachioradialis and extensor carpi radialis longus laterally. In between these structures, this nerve is running. See here, this is the radial nerve. Where it is present? It is present in between the brachialis medially, brachioradialis and extensor carpi radialis longus laterally. When it reaches to the anterior aspect of the lateral epicondyle, 1 centimeter lateral to the tendon of biceps, this nerve, that means radial nerve, will be divided into superficial branch, this is superficial branch, and deep branch. Very simple. Let me tell you the course of radial nerve up to here. It is branched from the posterior cord of brachial plexus. It is present in the axilla, behind the third part of axillary artery and proximal part of brachial artery. It leaves the axilla by passing through the lower triangular space along with the profunda brachii vessels. Then it passes through the spiral groove. When it reaches to the lateral end of spiral groove, it pierces the lateral intermuscular septum and becomes anterior. That means from here we can see the course here. First it was in the posterior aspect. Now it has been pierced in the lateral intermuscular septum. Then appears in the anterior aspect, where it is present in between the brachialis medially, brachioradialis and extensor carpi radialis longus laterally. Then anterior to the lateral epicondyle, 1 centimeter lateral to the tendon of biceps, it will be divided into two branches. One is superficial branch, another is deep branch. Now we will see superficial branch first, then we will go for deep branch. This is the superficial branch. This superficial branch is plastered under cover of brachioradialis. That means what? It is present deep to the brachioradialis. That means anterior relation of superficial branch is brachioradialis. So it will be running down up to the 7 centimeters above the wrist. It runs like this. It is present deep to which muscle? Brachioradialis. In the middle part of its course, it is in relation with the radial artery. So radial artery will be here. Now, superficial branch of radial nerve, when it reaches to 7 centimeters above the wrist joint, otherwise if you wanted to simply remember, at the junction of upper 2/3, lower 1/3 of forearm, it winds around the radius. It is passing deep to the tendon of brachioradialis. Then it pierces the deep fascia. After piercing the deep fascia, it enters into the dorsal aspect of the forearm and also become subcutaneous. So from here, remaining course we can see here. It descends down up to the anatomical snuff box. Everyone knows that this is the anatomical snuff box. So it will reach us to the anatomical snuff box, and it will divides into digital branches, and it supplies to lateral side of thumb, medial side of thumb by proper digital branches, and one more proper digital branch to the radial side of index finger. Then one common digital branch. This common digital branch will reaches to the interdigital cleft. It reaches to interdigital cleft, and it divides into two proper digital branches. They supplies to adjacent sides of index finger and middle finger. That means it has supplied to 2.5 digit, but in some textbook they will show that lateral 3.5 digit supplied by superficial branch of radial nerve, medial 1.5 digit only supplied by ulnar nerve. I will give you the clarification for that, why they have given like that. Actually, there is one more branch from the superficial branch of radial nerve that will be communicated with the branch of ulnar nerve. After communicating with the branch of ulnar nerve, it will be supplying to adjacent sides of middle finger and ring finger. That means dorsal branch of ulnar nerve is giving one proper digital branch which is running along the ulnar side of little finger, and it will be supplying to the ulnar side of little finger. This is what we call proper digital branch which is supplying to the ulnar side of little finger. Then it will give one more branch, that is common digital branch. When it reaches to the web in between the little finger and the ring finger, it will divide into two proper digital branches. These two proper digital branches will be supplying to the adjacent sides of little finger and the ring finger. Actually, there was communication between the radial nerve and the ulnar nerve. I will draw that communication with different color. This is the communication. This communication is giving more contribution to this common digital branch which is supplying to the adjacent sides of middle finger and the ring finger. Because of that, in some textbooks, lateral 3.5 digit and lateral 2/3 of the dorsum of hand will be supplied by radial nerve. Because of this reason. Why? Here, radial nerve giving common digital branch that is supplying to the adjacent sides of middle finger and ring finger. But some textbook they tell that lateral 2.5 digit supplied by radial nerve, medial 2.5 digit supplied by the ulnar nerve. Because see here, ulnar nerve is giving communicating branch that will be communicating with the common digital nerve which is supplying to the adjacent sides of ring finger and middle finger after dividing into proper digital branches. Actually, this common digital branch will be replaced by fibers of ulnar nerve. Because of that, they give that lateral 2.5 by radial nerve, medial 2.5 by ulnar nerve. So this is the clarification, because some textbook they tell that dorsal aspect of lateral 3.5 digits and the lateral 2/3 of the dorsum will be supplied by radial nerve. This is according to the some textbooks. But some textbooks they give that lateral 2.5 digit supplied by radial nerve, medial 2.5 digits supplied by the ulnar nerve. Why that confusion? Because of this. See here, if we consider this common digital branch is branch of radial nerve, that time lateral 3.5 digits will be supplied by the radial nerve. If we consider this common digital branch is branch of ulnar nerve, that time lateral 2.5 supplied by radial nerve, medial 2.5 supplied by ulnar nerve. Because here this is the communication, this communicating branch will be communicated with this common digital branch and it will be supplying to the adjacent sides of middle finger and ring finger. According to the Gray's anatomy, this communicating branch will be replacing this common digital branch. So that's it, the superficial branch of radial nerve. Now we'll discuss about the deep branch. See here, this is the deep branch. This deep branch of radial nerve leaves the cubital fossa, passing in between the two strata of the supinator muscle. Here is the supinator muscle. This supinator muscle having two strata, superficial strata and deep strata. In between these two strata, this nerve enters and winds around the neck of the radius. It winds around the neck of the radius within the substance of the supinator muscle and it appears here. See here, it has wind around here and it is appearing here. This is the extensor compartment of forearm. This deep branch of radial nerve passing through the substance of the supinator muscle and it is appearing here. So this is the deep branch. Is that clear? Now this deep branch runs in between the superficial muscles of extensor compartment of forearm and deep muscles of extensor compartment of forearm, and it passes through the one retinaculum which is present here. What is that retinaculum? Extensor retinaculum. So here there will be extensor retinaculum. This deep branch of radial nerve passes deep to the extensor retinaculum through the fourth compartment. Deep to the extensor retinaculum, there are 6 compartments are there. Through the fourth compartment, this nerve will passes deep to the extensor retinaculum, and at the level of the wrist, it forms the one ganglion here, but it is not original ganglion. Because of that, this is what we are calling pseudoganglion. This pseudoganglion will give nerve supply to the adjacent joints. What are those? Wrist joint, it is supplying to the inferior radial nerve joint, it is supplying to the intercarpal joints, and it will be terminated. So this is about the deep branch. Very simple. Deep branch of radial nerve leaves the cubital fossa after passing in between the 2 strata of the supinator muscle. When it is passing through the substance of the supinator muscle, it winds around the neck of the radius and it appears in the dorsal aspect. Then it leaves the supinator muscle and enters in between the superficial muscles and deep muscles of extensor compartment of forearm. After that, it descends down along with the posterior intraosseous artery, but in the lower part, it will be running along with the anterior intraosseous artery. Then it passes through the fourth compartment of extensor retinaculum and opposite to the wrist joint or at the level of the wrist joint, it will form one pseudoganglion. After formation of pseudoganglion, it supplies to the adjacent joints. That means it supplies to the wrist joint, it supplies to the inferior radial nerve joint, it supplies to the intercarpal joints. This is about the deep branch. Actually, this deep branch of radial nerve we can also call as posterior interosseous nerve. Anterior interosseous nerve is branched from the median nerve, posterior interosseous nerve is branched from the radial nerve. So this is the total course of radial nerve. Let me tell you the total course of radial nerve once, then we'll go for branches. Radial nerve is branched from the posterior cord of brachial plexus. In the axilla, it is present posterior to the third part of axillary artery and the proximal part of brachial artery, and it is present anterior to the structures which are forming the posterior wall of axilla. What are those? Subscapularis, latissimus dorsi, teres major. So it is present or it is sandwiched in between the posterior wall of axilla and the third part of axillary artery and the proximal part of brachial artery. Now it has to leave the axilla so that it will find one door. That door is lower triangular space. So it passes through the lower triangular space. Lower triangular space boundaries are superiorly by teres major, laterally by medial border of humerus, medially by long head of triceps. Through this lower triangular space, along with the profunda brachial artery. Profunda brachial artery is branched from the brachial artery. Now, after passing through the lower triangular space, it enters into the groove which is present in the posterior surface of the humerus. What is that groove? Spiral groove. So, it enters into the spiral groove through the medial end. Then it passes through the spiral groove and reaches to the lateral end of the spiral groove. At the lateral end of spiral groove, nerve decided to come anteriorly. But here, one intermuscular septa is there. So, if it pierces the intermuscular septa, then only it can come to the anterior aspect. So, it has pierced this lateral intermuscular septum. Then it became anterior. That means it enters into the anterior compartment of the arm. In the anterior compartment of arm, it is present in between the brachialis muscle, brachioradialis and extensor carpi radialis longus. Then, opposite to the lateral epicondyle, it divides into 2 branches, superficial branch and deep branch. If you take superficial branch first, superficial branch is plastered under cover of brachioradialis. That means it is present beneath the brachioradialis. Otherwise, it is present posterior to the brachioradialis. Relations of superficial branch, it is present deep to the brachioradialis muscle. and it is present anterior to some muscles from above downwards. It is present over the supinator muscle, pronator teres, flexor digitorum superficialis and flexor pollicis longus. When it reaches 7 centimeters above the wrist joint, otherwise at the junction of upper 2/3, lower 1/3. At this level, superficial branch passes deep to the tendon of brachioradialis and winds around the radius. So it winds around the radius and appears in the dorsal aspect of the forearm. After that, it descends vertically down and reaches to the anatomical snuff box, where it will divides into one proper digital branch which is supplying along the radial side of thumb, and one more proper digital branch which will be supplying along the ulnar side of thumb, then another proper digital branch which is supplying along the radial side of index finger. Then here it gives one common digital branch. This common digital branch runs downwards and reaches the web in between the index finger and middle finger, where it will divides into two proper digital branches, and it will be supplying to the adjacent sides of index finger and middle finger. One more common digital branch, it will runs up to the web in between the middle finger and ring finger, where it will be divided into two proper digital branches. Those proper digital branches will be supplying to the adjacent sides of middle finger and ring finger. So according to this concept, radial nerve is supplying to the lateral 3.5 digits. Now we will see the dorsal branch of ulnar nerve also. This dorsal branch of ulnar nerve is giving one proper digital branch which is supplying along the ulnar side of little finger, one common digital branch which is supplying to the adjacent sides of little finger and ring finger. There is a communicating branch in between the ulnar nerve and the radial nerve. This communicating branch will replace this common digital branch and supplies to the adjacent sides of middle finger and ring finger. If you take this concept, lateral 2.5 digits will be supplied by the radial nerve, medial 2.5 digits will be supplied by the ulnar nerve. This is about the superficial branch. One more thing you have to strongly remember here, these dorsal digital nerves will be supplying to the dorsal aspect of the fingers, but not nail beds. Those nail beds are not supplied by the dorsal nerves. They are supplied by the palmar nerves only, palmar digital nerves. Why? There is embryological reason here. What is that? See, during development, tips are there, no? These tips of the fingers will be migrated back and forms the nail bed. Because of that, that migrated part will take their own nerve supply. That means this palmar digital nerves will be going back and supplies to the nail beds. For that, there are some more minor details are there. Those are not necessary for the use level. Actually, the dorsal nerves which are supplying to the thumb can be reached up to the root of the nail. Then if you take the index finger, those dorsal digital nerves will be supplying up to the middle of the middle phalanx. Then if you take the other fingers, they will not reach beyond the base of middle phalanx. These minor details are not necessary. You remember only nail beds are not supplied by the dorsal nerves. They are supplied by the palmar digital nerves. That's it about the superficial branch. Then deep branch. Deep branch is branch of the radial nerve at the level of lateral epicondyle. It leaves the cubital fossa after passing in between the two strata of the supinator muscle. Otherwise, deep branch will pierce the supinator muscle. Anything is okay. So it passes in between the two strata of the supinator muscle and it winds around the neck of the radius and appears in the dorsal aspect. It leaves the supinator muscle and it enters in the posterior compartment in between the superficial muscles and the deep muscles of extensor compartment of forearm. Now the nerve is present in between the superficial muscles and deep muscles. Then it runs downwards, then it is passing deep to the extensor retinaculum, that too through the fourth compartment. And opposite to the wrist joint, it forms one pseudoganglion. After formation of pseudoganglion, it supplies to the adjacent joints. Those are wrist joint, inferior radial nerve joint, intercarpal joints, and it will be terminated. So this is about the deep branch. Now we will see the branches of radial nerve. See here, branches of radial nerve in the axilla, branches of radial nerve in the chiral groove, branches of radial nerve in the cubital fossa, branches of radial nerve in the posterior compartment of forearm. Branches of radial nerve in the axilla. I am drawing those branches here. One branch to this head. What is this head? Long head. One branch to the long head of triceps and one branch to the medial head of triceps. One muscular branch to the long head, another muscular branch to the medial head. Then it gives one cutaneous branch also. That cutaneous branch is posterior cutaneous nerve of arm. That cutaneous branch is posterior cutaneous nerve of arm. These are the three branches which are arising in the axilla. That means two muscular branches, one cutaneous branch. Then coming to the branches which are arising in the spiral groove. See here, this is the nerve which is present in the spiral groove. So it will give one branch towards the lateral side to the lateral head. See, it is giving branch to the lateral head of triceps. One more branch to the medial head of triceps. The branch which is supplying to the medial head of triceps, it descends down within the substance of the medial head of triceps and it will supply to the anconeus muscle. You must be aware of it. Here, this is the lateral epicondyle. From the posterior aspect of the lateral epicondyle, one muscle is arising. That muscle is inserting to the lateral surface of the olecranon process. This muscle is anconeus muscle. So, narrow to the medial head of triceps. After supplying to the medial head, it descends down and supplies to the anconeus muscle. So, this is about the muscular branches which are arising from the radial nerve in the spiral groove. Then there are cutaneous branches also. Two cutaneous branches. One is posterior cutaneous nerve of forearm, another is lower lateral cutaneous nerve of arm. So, if you take, this is the lower lateral cutaneous nerve of arm, it pierces the lateral head and supplies to the lower part and the lateral aspect. Lower part and the lateral aspect of the arm. What about upper part and lateral aspect? Upper lateral cutaneous nerve of arm is branched from the axillary nerve. So, here lower lateral cutaneous nerve of arm is branched from the radial nerve in the spiral groove. Then one more branch that is also arising in the spiral groove. That branch is posterior cutaneous nerve of forearm. So like this, it passes behind the lateral epicondyle and it supplies to the posterior aspect of the forearm and also part of the dorsal aspect of the hand also. So these are the branches of radial nerve in the spiral groove. Recollect once again. One branch to the lateral head, one branch to the medial head. The branch which is supplying to the medial head, after supplying to the medial head of triceps, it passes through the substance of the medial head and reaches to the anconeus and supplies to the anconeus. That means three muscular branches. Here only two muscular branches in the axilla. Then how many cutaneous branches? Two cutaneous branches. One is lower lateral cutaneous nerve of arm and another is posterior cutaneous nerve of forearm. This is the posterior cutaneous nerve of forearm. Is that clear? So here three muscular branches and two cutaneous branches. Now we will see branches at the lower lateral part of the arm. In the anterior aspect of the lower part of the arm, it is present in between the brachialis muscle, brachioradialis, extensor carpi radialis, longus. So it is present in between these muscles, so that it supplies branch to the brachioradialis. Here it is giving branch to the brachioradialis, branch to the extensor carpi radialis longus, and branch to the brachialis muscle. Is that clear? Here it will give small twig to the elbow joint also. Very simple. Just above the bend of elbow, it is giving branch to the brachioradialis, branch to the extensor carpi radialis longus, branch to the brachialis. Actually, brachialis will be supplied by muscular cutaneous nerve, but the proprioceptive fibers will be supplied by the radial nerve. Because of that, brachialis muscle is hybrid muscle or composite muscle because it is having the dual innervation. Coming to the deep branch. Deep branch, before entering into the supinator muscle, it gives two branches. One branch to the supinator, another branch is to the extensor carpi radialis brevis. See here, this is the extensor carpi radialis longus. No, deep to this, there is one more muscle is there. That is extensor carpi radialis brevis. So that extensor carpi radialis brevis before entering into the substance of the supinator muscle. Is that clear? Okay. Recollect here. In the anterior aspect of the lower part of the arm, just above the elbow joint. It is supplying to the brachioradialis, extensor carpi radialis longus. Along with that, proprioceptive fibers to the brachialis. In the cubital fossa, just before the deep branch is entering into the supinator muscle. That means now we are discussing about the branches of deep branch. See, branches of deep branch are one branch to the extensor carpi radialis brevis, one branch to the supinator. After that, nerve is passing through the substance of the supinator. Within the substance, it takes one more branch. This is the advantage. When the nerve is passing through the substance, it can take one more extra advantage. That means supinator muscle having 2 times nerve supply before entering into the supinator and within the substance of the supinator. Is that clear? Next, branches in the posterior compartment of forearm. What are the posterior compartment of forearm muscles? Anconeus muscle, already supplied. Extensor carpi radialis longus and brevis, already supplied. Brachioradialis, already supplied. Supinator, supplied. Then what are remaining now? Extensor digitorum, extensor digiti minimi, extensor carpi ulnaris in the superficial set. Then in the deep set, abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis and extensor indicis. These muscles are remaining now. So by 3 short branches, extensor digitorum will be supplied, extensor carpi ulnaris will be supplied and extensor digiti minimi will be supplied. Extensor digiti minimi, extensor digitorum and extensor carpi ulnaris. By 3 short branches, these 3 muscles will be supplied. By 2 long branches, remaining 4 muscles will be supplied. What are those? Abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus and extensor indicis. So these are the muscular branches of posterior interosseous nerve, otherwise deep branch of radial nerve. Now we will see completely all branches. In the axilla, 2 muscular branches, 1 cutaneous branch. 2 muscular branches are, one is to the long head, another is to the medial head. Cutaneous branch, posterior cutaneous nerve of arm. Then in the spiral group, 3 muscular branches, 2 cutaneous branches. One branch is to the lateral head, another branch is to the medial head. The branch which is supplying to the medial head will be passing through the substance of the medial head and it will be supplying to the anconeus. That means 3 muscles are supplied. Then 2 cutaneous branches. These 2 cutaneous branches, they pierces the lateral head of triceps and they becomes lower lateral cutaneous nerve of arm, posterior cutaneous nerve of forearm. Then in the cubital fossa, it is supplying to the branch to the brachioradialis, branch to the extensor carpi radialis longus and branch to the brachialis muscle. Actually proprioceptive fibers. Then it has been divided into 2 branches, superficial branch and deep branch. Superficial branch we have already discussed. Then deep branch. Deep branch will be giving branch to the extensor carpi radialis brevis and supinator before entering into the supinator muscle. Within the supinator muscle, it supplies one more pig to the supinator. After that, deep branch winds around the neck of the radius and appears in the posterior aspect or posterior compartment of the forearm in between the superficial muscles and deep muscles of extensor compartment. Actually, deep branch of radial nerve, what we call posterior interosseous nerve. Here, it will be divided into 3 short branches and 2 long branches. These 3 short branches will be supplying to the extensor digitorum, extensor digiti minimi and extensor carpi ulnaris. Then 2 long branches will be supplying to the abductor pollicis longus, extensor pollicis brevis. Then extensor pollicis longus, extensor indicis. So this is the course and relations of the radial nerve. Now we will discuss about the applied aspects. See here. Radial nerve will be injured in the axilla because of the improper usage of crutch or the fracture of the humerus. If the radial nerve is injured in the axilla, what will happen? All muscles of extensor compartment of arm, extensor compartment of forearm will be paralyzed, so that there is no extension of elbow. Elbow will be fixed in the flexed position and there is no extension of the wrist because all extensor compartment muscles of forearm has been paralyzed, so that wrist will be in the flexed position. This position or this deformity, what we call wrist drop. Along with that, loss of sensation over the lower half of the lateral aspect of the arm, posterior aspect of the arm and the posterior aspect of the forearm. Along with that, lateral half of the dorsum and lateral 2½ digits except nail beds. So these areas sensation will be lost if the injury happened in the axilla. Then if the injury happened in the spiral groove, when it will happen? Because of the fracture of humerus at this level, otherwise Saturday night palsy. Whenever the person moves fully and if he sleep over the armchair, there will be compression between the spiral groove and the wood of that armchair, which leads to temporary paralysis. That means temporary radial palsy. After that it will be recovered if the injury is minimal. That condition what we call Saturday night palsy, right? In that case, if the injury at the level of the spiral groove, there will be extension of elbow, but it is weak. Why extension is there? See here, long head is innervated by the radial nerve within the axilla itself. Medial head also will be supplied by the radial nerve within the axilla. So that two heads are remaining. Because of that, extension of elbow will be there, but it will be weak. Then there will be wrist drop. Why? Extensor compartment of forearm muscles will be extending the wrist. Those muscles are paralyzed. So that wrist will be in the flexed position. That is what we call wrist drop. Wrist drop will be there, but the extension of elbow will not be affected much because long head and medial head has been already innervated in the axilla itself. Along with that, loss of sensation over the lower half of the lateral aspect of the arm and the posterior aspect of the forearm. Along with that, lateral half of the dorsum and lateral 2.5 digits except nail beds. It will happen in the honeymoon palsy also. Honeymoon palsy means compression of radial nerve in between the bone and the head of your loved one, right? So that time also radial nerve will be compressed. Clear? Then coming to the injury at the radial tunnel. What is radial tunnel? The nerve which is passing through the supinator muscle. That time the upper margin, see here, this is the upper margin of the supinator muscle. This upper margin of supinator muscle, sometimes it becomes very sharp and fibrous. That time, if the nerve is injured here, what will happen? The muscles which are supplied by the posterior intraosseous nerve after passing through the supinator muscle, those muscles will be paralyzed. But here, there is no wrist drop. Only weakness will be there, but there is no wrist drop. Because here, extensor carpi radialis longus and brevis, they are strongest muscles to extend the wrist. That's what wrist drop will not be there, but the loss of extension of the fingers. Because extensor digitorum has been paralyzed, extensor digiti minimi has been paralyzed, extensor indicis has been paralyzed, extensor carpi ulnaris also has been paralyzed. Because of extensor digitorum, extensor digiti minimi and extensor indicis has been paralyzed, there will be loss of extension of the fingers. But extension may happen in the middle and distal phalanges because of the lumbrical muscles. So this is about complete radial nerve.